But first, let's start with Canada's healthcare crisis. From surgical backlogs to emergency room closures to staff burnout, it's a coast-to-coast-to-coast problem and the focus of a meeting between the premiers of Ontario, New Brunswick, Nova Scotia and PEI. Their message was clear. The system is broken and all options are on the table, they say, to fix it. The CBC's Megan Fitzpatrick has more.
Vashi, the premiers described their meeting today as spirited at times, but also as a productive get-together. The premiers were talking about a number of issues, including energy security, immigration, but also healthcare. That really was the focus of their discussions today, and that is because their provinces, like other provinces across the country, having a tough summer when it comes to staffing shortages in their hospitals. And Premier Doug Ford sat down not only with his counterparts today, but also the Federal Minister of Intergovernmental Affairs, Dominic LeBlanc, and Ford said they had a, quote, phenomenal conversation. Ford was saying that he not only wants to work with his fellow premiers, but with the federal government to help solve these challenges facing their healthcare systems. He and the other premiers also said that the status quo is not good enough, that things have to change in order to deliver better healthcare to the residents of their provinces. They said they're exploring innovative solutions, including who is delivering healthcare in their provinces, potentially using paramedics more or nurse practitioners more. They were calling for innovation and creativity. Premier Doug Ford saying, working together with the premiers and the federal government, he's confident that better healthcare can be delivered to all Canadians. Vashi?
Thanks, Megan. The CBC's Megan Fitzpatrick there in Toronto. For more on what happened during the meetings, Blaine Higgs is Premier of New Brunswick. He's with us tonight from Moncton. Premier Higgs, good to have you back on our program. Thank you for making the time.
You're very welcome, Vashi. Nice to be here.
I certainly want to ask about potential solutions, but I first want to start on the nature of the problem. And Canadians will have read and heard in recent weeks about 2 people in your province who died while waiting for emergency care. Is New Brunswick in the midst of a healthcare crisis? And as Premier for the last number of years, how much of that is your responsibility?
Well, Vashi, I think we're not unique here in New Brunswick, and we have a healthcare crisis across the country. That's been, enhanced by the COVID experience that we've all gone through, but we're seeing it everywhere, and yes, we're seeing the same things here. I think what the biggest challenge that we have in front of us is, yeah, there's more money that can be put into the system, but we've been putting more money into it for years and years. But what we haven't done is fundamentally look at how we change it, and it becomes focused on the actual patients and the citizens of each province. It can't be territorial, it can't be, this is fine, change, but you can't change my practice. We all have to be innovative. And I really love it when physicians will say, okay, here's something we can do differently. And they have ideas, not just, give me more money and we'll do better. We've been doing that. So now's the time. I think people expect better. And we have to be bold enough as politicians to deliver better. And I think that's a message that clearly came out of this meeting.
So just on that message, though, we've spoken a number of times on this program and other premiers as well, where the ask of the federal government is very much what you just said isn't needed, more money. Is that a juxtaposition? Is there some irony there that you're saying the system doesn't need more money, it needs to be better spent, is what I read from what you just said. But at the same time, you've been demanding, and other premiers have been demanding, more money from the federal government. Is that money really necessary?
So, no, I'm not suggesting we won't need more money. Healthcare continues to go up, especially in provinces that the demographics are such that, healthcare costs are increasing just by that factor alone. But what I'm saying is that it has to be coupled with direct improvement in outcomes for the people in each province. So in other words, if money comes in, there has to be a corresponding, what are we going to see better? What wait times are going to reduce? What surgery times are going to reduce? Whether it be hip and knee, whatever it may be. What is the wait time to get in to see specialists? How do we engage more people into the critical issues and have an alternate source for people that actually, aren't critical and just need to get into a clinic? There also actually has to be a recognition that the age-old kind of situation where everyone has a family doctor by name is likely going to change, and it will change because today doctors don't want to work 10, 12, 14, 16 hours a day and have thousands of patients that they alone service. They want clinical type of operations where they can have a life to go with that. You can't blame healthcare professionals to want a life to go with their profession. We all want that. So those are the things that are going to change. Demands have to be changed for what people expect, but we have to deliver a better health care for what people need. And the public need to feel that when they go to have care, especially when they're in real need.
Okay, let me parse that answer out a little bit and start with the beginning, in which you said basically outcomes will have to correspond to investments made. That is exactly what the federal government has said about any extra money that might come to provinces for healthcare, that there essentially have to be strings attached, that outcomes would have to certainly be connected in some way to the amount of money. They've had pushback from the provinces on that. Are you okay with strings attached, Premier?
I am, actually. I've never disagreed with having, money invested. To me, money invested isn't worth much if you don't see anything coming out of it. You don't have any real measurable performance. So this way, for me, it's like, don't prescribe where we put the money, but let's agree on what a better healthcare system looks like. Let's spend time understanding what do people really want in terms of healthcare. Is it a case that I have regular checkups? I know my health is not deteriorating. I'm staying on top of it so it doesn't become a shock if serious situations arise. How do we deliver that? And I really think we can. So having it tied to performance and what does good healthcare look like and how do we measure that, I think is an absolute necessity. In order to get that better healthcare system, we must.
And just to circle back to my original question, and again, I do ask with respect, but you have been Premier now for a number of years. I understand that the pandemic exacerbated issues and that many provinces across the country are feeling the same acute issues that you're describing. But I think a lot of Canadians watching are finding it tough hearing from leaders who have been present for a number of years, who have known about staffing issues for a number of years, and have not adequately addressed it, to keep hearing, well, things are different. It's hard. It was the pandemic. What kind of responsibility do you take for allowing, taking into consideration the extraneous factor of the pandemic, but for allowing things to get to the level they're at right now?
Well, I guess, Vashi, as a Premier of the province, I have to take responsibility for correcting the situation. It isn't anything that happened overnight. It isn't anything that just happened because of the pandemic. The pandemic certainly heightened the awareness and the criticality of our service. But I certainly am taking responsibility to make a huge improvement. And if you follow what we've done recently to expedite our ability to make decisions and have quick change, we've made a major shift in enacting a clause that basically said for the public interest, we're going to change and have a task force type of an operation that basically can make decisions for our healthcare system. And in New Brunswick, whether that be in Vitality and Horizon, we work together to achieve better outcomes. So I am taking responsibility to make a change. But as you know, healthcare has been the nemesis of just about any government at any point in time. Anytime change comes, anytime there's any real effort to improve it, then the opposition just spends their time criticizing. Well, I'm prepared to take the criticism because at the end of the day, I want to see our people in our province have better health care. And if I take a beating because of that, so be it. But we're going to make every effort possible to have improvement in people's lives, their quality of life, and their ability to get quality health care in New Brunswick.
Certainly, Premier, I'm sure you don't mean that the opposition is at fault, though, for the inadequacies of the healthcare system. I mean, it's their job to challenge you. And just so that our audience knows, when you refer to the big shakeups lately or the changes you've made, we're talking about massive changes at the highest levels of bureaucracy in the sort of health authorities there, as well as a change of your health minister. There has been some criticism from the opposition that there's less accountability because of those changes. Your response to that?
Well, sure. Would you expect anything different from an opposition? I mean, that has been the stalemate in any change.
It's fair of the opposition to worry about accountability.
As soon as it becomes, to the forefront, opposition are geared to oppose. I mean, that is what has stalled healthcare. So, let the opposition begin. But when we have results that people are seeing every day, I'll let the patients, the people that are going to our emergency rooms, are going to receive healthcare, are getting better wait time reductions, are seeing better performance in terms of their health. Then I'll let them be the judge, and the opposition will be what it'll be, because that's what every government has seen. I'm not blaming any particular opposition at this time. It's been the way healthcare has been for generations. It's time for that to change.
And what makes you think, Premier, just running out of time here, what makes you think that you'll be able to enact anything different? Because you haven't over the last 4 years, with respect. And I take your point about the opposition, but the opposition is also holding your government and other governments across this country to account. They have a function to perform, not just simply to stand in the way.
Well, actually, during the pandemic, I think, we worked with healthcare professionals, a small group that helped guide us through the pandemic. And I think that in that process, things went relatively well. And I think that's what we're doing, the same thing right now. And for me, I'm committed to doing this. And I know there might be a whole lot of people that would spend more time focused on the next election. But right now, I'm focused on healthcare and delivering well in advance of any election. But it'll create some disruption. But we all must be prepared for change. That is the biggest roadblock to innovation, is people resisting change. We must change to deliver healthcare, but it's not unique to New Brunswick. And I guess I come back on that because it is a cross-country situation. And public healthcare as it exists today is not managed properly. We do not manage our processes. We do not manage our resources. And you go right through it and say, yes, we need more money, but we need to manage and get better results for the people that are spending this money.
Okay, Premier, I'm out of time. Thank you very much for your time this evening.
You're very welcome, Vashi.
Blaine Higgs is the Premier of New Brunswick. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.